Hi, my name is Sasha, and today I'm going to be doing a cardiovascular assessment on my patient. Hi there, what's your name?
My name is Craig.
Hi Craig. My name is Sasha, and today I was wanting to do a cardiovascular assessment on you. Okay, so it just involves me palpating, auscultating to having a listen and a look, also just to get a better idea of what's going on with your heart, if that's okay. Would you be alright with it?
That's fine.
Cool, that sounds good. So before we begin, I just want to confirm your name, your age, and your date of birth, if that's alright.
Okay, my name is Craig. I'm 23 years old and I was born April 8th, 1993.
Okay, cool. So to do my assessment, Craig, I'm going to obviously be having a look and listen of your chest, so I'm going to need you to pop your shirt off if that's alright.
Okay.
Cool, so you can go ahead and do that.
That's all.
Thank you. So before we begin the assessment, I want to ask you a few questions if that's okay.
Okay.
Cool. So, are you on any medications at the moment?
No, not.
No medications at all?
No.
Cool. So, do you have any health issues or any cardiac issues, family history maybe?
No, none at
Of
all.
anything like that? No, nothing? None that you know of?
No.
Cool. So that's good too. So also, before I do start, are you on any pain at the moment? Any radiating pain, any
No.
sharp pain, anything? Nothing at all?
Nothing at all.
Cool, so that's good too. So to begin with, Craig, I'm going to be starting with your hands, if that's alright.
Okay.
So is it alright if you just pop your hands out for me like this? Thank you. So just looking at colour, which is really good at the moment, good skin tone, good perfusion. The nail beds, there's no brown scaling or anything like that. No lumps or anything, or any abnormalities. Could you please just put your fingers together like this, Craig? Cool, so they're coming together, which is good. Bring your hands down like this for me. So also looks good on this side too. No sort of bruising or any discoloration or anything like that. You can bring your hands back around like this for me. Just gonna check capillary refill, which also looks good too. So you can pop your hands back down. So I want to now have a feel of your radial pulses, which is just the pulses on your wrist here, if that's okay.
Sure.
Cool, so that feels strong and regular. Is it alright if I do the same on the other hand?
Sure.
Cool, so they both sound strong and regular, and there's no differences between the two, which is good. I also want to have a feel of your pulses up here, your brachial pulses, if that's okay.
Okay.
It's also strong and regular. Cool, that feels strong as well. So now I'm going to be having a feel of your pulse here, your brachial pulse, but I also be moving your hand up and down, if that's okay, just looking for any resistance or any strain or anything like that. So you said before that you're not in any pain. Are you currently in any pain?
No.
Cool, that's good to hear. So while I'm doing that, moving your arm, if you do feel pain, then by all means let me know.
Okay.
Cool. No pain?
No.
Cool, that's good too. So now I'm going to have a feel of your carotid pulses, if that's okay. So just the left and the right, if that's alright.
No problem.
That feels strong and regular. That also feels strong and regular. So Craig, are you in any pain or discomfort in your tummy area at the moment?
No.
Nothing at all? Would you mind if I just push on it a little bit?
Please.
Cool. And while I'm doing that, is it alright if I just tilt your head to the left there, just so I can have a look at your JVP?
Okay.
Just your veins up there on your neck. Cool. If there's any pain, just let me know.
No problem.
Any pain?
No.
No pain, that's good. So I also want to do a blood pressure on you as well, that's just a part of the assessment, just to check if your blood pressure is a bit higher than normal, lower, or anything like that. So that's good. So also I want to have a look at your eyes, if that's okay. So I'm just going to get you to pop your eyelid down one at a time, if that's alright.
Okay.
Just having a look there. Cool, that looks good. The outside. Cool, that looks good too. And also I want to have a look in your mouth if that's okay. So if you just open your mouth for me. Yep, tongue up. Cool, that looks good too. So now I'm gonna just want to have a look at your chest, just an overall sort of look. That's alright.
Okay.
So I can't see any scarring or anything like that, any lumps or anything abnormal. I'm also going to just want you to, if you could one at a time, bring your arms up like this for me.
Okay.
If we're just looking for any strain. Cool, that was very good. I'm also now going to want to actually palpate your chest, so I'll just be pushing on your chest. While I'm doing that, I'm just going to be asking you if you're in any pain or if it changes or anything like that, if that's alright.
Okay, no problem.
Cool. Just going from the second intercostal down to the fifth. There's nothing there.
No, nothing.
Good.
Nothing.
So I'm just going to feel for murmurs as well, if that's okay.
Okay.
I'll also be pushing down as well.
Right.
So if there's any pain, just let me know.
Will do.
Anything there?
Nothing.
Nothing? That's good. So now I'm actually going to have a listen to your chest. So I'll be listening to the valves of the heart as well as I want to have a listen to your lungs if that's alright.
Okay.
Cool. It's a little bit cold, so please don't be too afraid.
Thank you for the warning.
There we go.
Okay.
So we're going to the aortic valve. So while I'm doing this, I'm just looking for any extra sounds or anything like that, just trying to see if there's anything abnormal.
Okay.
So the aortic valve sounds good. Pulmonary valve. That sounds good too. Tricuspid valve. That sounds good too. The mitral valve. Sorry, very cold.
That's okay.
The mitral valve sounds good too. So I'm just gonna switch over to the valve there and I'm just gonna repeat what I just did if that's okay.
Okay.
Good. So the aortic valve again. Good, this one's good. Pulmonary valve. That's good. Tricuspid valve. Good, mitral valve. That's good. So Craig, I'm just going to ask if you could just turn to your left a little bit for me. Just slightly. Thank you. Just leaning over you here. If you could take a deep breath in. And out. And again. And out. Cool, so that's good. If you could just sit up for me. A lot of moving.
That's okay.
Cool. So deep breath in. And out. Cool. So breathing normally. I'm just going to have a listen to the lower lobes of your lung. I'll be doing it from your back if that's alright.
No problem.
Cool. So deep breath in. And out. And again. And out. I'm also just going to palpate just down here on your lower back and your sacral if that's alright.
Okay.
Just looking for any abnormalities or any lumps or anything like that. So it feels good. Nothing worrying down there. So you can sit back down. So the last bit of my assessment, Craig, is going to involve me having a look at your ankles if that's okay. Just looking for swelling or anything like that. Yeah.
No problem.
So this is normal for you?
Yes.
They don't seem a little bit swollen or anything like that?
Nope.
They look a good colour. Perfusion is good. That's good. So Craig, that's my assessment done on you. Thank you for letting me do that on you.
No problem.
You can pop your shirt back on.
Thank you.
But yeah, thank you.
Yeah.
Cool, so just to summarise this cardiovascular assessment that I've done of Craig, who is a 23-year-old male. On first glance, he was comfortable, not short of breath. He didn't look like he was in any distress or pain at all. He also was not on any medication, no health issues or cardiac issues, family history that he knows about, which is good. And he also, on palpation, had no abnormalities, no deformities, nothing that I would be worried about. Also in auscultation, there's normal first and second heart sounds. There was nothing extra or any murmurs or anything like that that I'd be worried about. So overall, I would say that this was a normal cardiovascular assessment, and in saying that, I would say that this would put Craig as a low acuity patient, which would be like a status 4 patient. And if he was to have presented with the opposing symptoms, then I would then say he was a high acuity patient, which would therefore then be a status 1 patient who would need immediate medical attention. But all in all, this assessment that I've done on Craig has been a normal cardiovascular assessment. So yeah, thank you for watching.